TedTrial. When was the last time you had an annoying itch on your back? Remember how frustrating it was not being able to explain to someone where to scratch precisely? That is exactly how a surgeon feels wearing sterile surgical gown and gloves, but in need to interact with radiologic images on a computer during surgery. Because a surgeon is not able to interact with the computer directly without compromising sterility, an operation room circulating nurse has to do so on surgeon's behalf. A little bit up, no down. A little more, a little less, no stop. Thanks to TedCube, an innovation currently researched in the Academic Medical Centre in Amsterdam, these problems will soon be a thing of the past. For example, during abdominal and trauma surgery, there are currently iterative actions in the OR environment that have to be outsourced to a third person because the surgeon can't execute these actions whilst performing surgery. The surgical lights have to be switched off. The surrounding lights have to be switched to green light. The laparoscopic setup, such as an insufflator and camera, have to be activated. During surgery, radiologic images often have to be reviewed. The surgeon decides on the optimal setup, but cannot do so him or herself. Hence, the surgeon has to instruct a third person to act on his or her behalf. Delays and misunderstandings are the logic result of this extra communication step. The wrong light is often switched on, the image is not displayed correctly, or the circulating nurse is busy with another task and simply not available. The TedCube should offer the solution. This device acts as a remote controller, enabling the surgeon to interact directly with technology present in the operating room without touching these devices. The surgeon wears a wireless headset and/or armband on the most proximal part of the forearm under the sterile gown. Using TedCube, a Bluetooth USB connector and wireless controller, the surgeon interacts with the main OR computer. Using the forearm wearing the armband, the surgeon's forearm acts as a wireless mouse. Small movements enable the surgeon to scroll through a scan on his own, whilst preserving sterility and staying near the patient. Using the headset with built-in microphone, the surgeon can give specific verbal commands that start or stop pre-coded pathways, instructing the computerized OR environment. For instance, Start Procedure activates a preset surgical ambience with correct lighting and setup of equipment. With the command line Stop Procedure, this is reversed. Using TedCube and associated wearables allows professionals in the operating theatre to focus on primary tasks, such as surgery again. Surgeons are no longer distracted having to communicate to and correct others on tasks essential to perform good surgery, but not in direct reach. Now the surgeon controls the resources he or she needs to execute the surgery optimally and stays in focus. And also the circulating nurse saves time to execute other important activities. The new technique does not pose an additional risk to the surgery, because if the system should fail, the surgeon can of course always fall back on the current standard, using third-person interaction. The Academic Medical Centre in Amsterdam is studying optimal use and implementation of the TedCube system, together with the Spanish company TedCas. User satisfaction, error reduction and efficiency are endpoints of study. At the end of 2018, the project group hopes to present their results and announce that using TedCube and wearables in the operating theatre is here to stay.